Welcome to Basic Principles of Mental Health and the Mental Health System for EMS. In this introduction, we want to emphasize why this topic matters for EMS professionals. Behavioral and psychiatric emergencies are not rare at all. In fact, studies have found they make up about 10 to 12% of EMS responses, which is comparable to the number of trauma calls. So, this is something you will encounter regularly on the job. It's important to remember the mind body connection. Mental and physical health are deeply intertwined. For example, extreme stress can cause physical symptoms like chest pain, and a head injury can cause major changes in behavior. Every illness or injury has an emotional impact, and changes in mental state can also affect physical well being. Also, mental health crises can happen to anyone. Nearly everyone experiences emotional turmoil or a crisis at some point, losing a loved one, losing a job, going through a divorce. These situations can lead to intense emotions, but feeling upset or down during tough times is often a normal reaction, not necessarily a mental illness. We shouldn't jump to labeling someone as mentally ill just because they're having a hard time. Let's address some myths versus reality. One common misconception is that people with mental health disorders are usually violent or dangerous. The reality is that most are not violent at all. In fact, they're more likely to be victims than perpetrators. Only a small percentage of individuals with mental illness become violent, and those cases often make the news or end up involving EMS, which might skew our perspective. As EMS professionals, we may see a higher proportion of aggressive or out of control behaviors simply because those are the situations where someone calls 911. But it's critical not to stigmatize all patients with mental health conditions as dangerous. Treat each patient as an individual. Finally, recognize that EMS plays a crucial role in the mental health system. We're often the first professional caregivers to arrive when someone is in a psychiatric crisis. How we approach and care for these patients can calm the situation and set the stage for recovery, or if handled poorly, can escalate the crisis. So, our goal in this presentation is to give you a strong foundation in dealing with mental health emergencies safely, compassionately, and effectively. Before diving deeper, let's clarify some key terms and concepts so we're all on the same page. First, what is behavior? In simple terms, behavior is how a person acts or performs, basically what you can observe them doing. We sometimes differentiate between overt behavior and covert behavior. Overt behavior is out in the open, easy to see, and generally understood by others. For instance, if someone is screaming or pacing, that's overt, everyone can see they're agitated. Covert behavior, on the other hand, has hidden meanings or intentions. The person might be acting one way outwardly, but there's something else going on internally. For example, someone might appear calm, but actually be planning to harm themselves or others. As EMS professionals, we mostly respond to what's overt, what bystanders or family notice and call us about. But being aware that there could be more under the surface, covert, is important. Now, what do we mean by a behavioral emergency? Generally, this refers to a situation where a person's mood, thought, or behavior is so far outside the norm that it's disrupting their life or the lives of people around them. It might not always be life threatening, but it's concerning enough that somebody calls for help. For example, imagine a person who, after a stressful event, is crying uncontrollably, shouting, and unable to calm down to the point that they can't take care of themselves. That's a behavioral crisis. It interferes with their activities of daily living, like eating, communicating, or basic safety. In contrast, a psychiatric emergency is usually a step up in severity. It implies there's a safety threat. This is when a person's behavior is not only abnormal, but also potentially dangerous to themselves or others. Think of scenarios like a person expressing plans to commit suicide, a threat to self, or someone aggressively attacking family members due to a psychotic episode, a threat to others. In a psychiatric emergency, the stakes are higher, and immediate intervention is critical to prevent harm. It's interesting to note that what qualifies as an emergency often depends on who calls 911. In other words, an event is an emergency if someone perceives it as one. The person in crisis or those around them might dial 911 because they feel things are out of control. Sometimes we might arrive and think, this doesn't seem so bad. But we should take every call seriously. The patient's feelings are real to them. If it was serious enough for someone to call for help, we approach it as a legitimate emergency. Validation of the caller's concern is important. Even if the issue seems minor at first glance, our presence and assessment can reassure everyone involved. Finally, you'll hear the terms organic versus functional causes for mental symptoms. This is a fundamental distinction in mental health. Organic causes, also called biological or physical causes, mean that the abnormal behavior has a physical or medical origin. There's something going on in the brain or body causing the symptoms. For example, low blood sugar, a brain injury, or a severe infection can lead to confusion or bizarre behavior. In these cases, treating the underlying medical issue often improves the mental symptoms. Functional causes are psychological. The brain is structurally normal, at least as far as we can tell, but the person is experiencing a mental illness or issue like schizophrenia or severe depression. There's no tumor, no low oxygen, no infection causing it. It's a primary psychiatric disorder. These are the cases where the brain's function is impaired, but not due to a detectable physical problem. For EMS, this distinction is important because if it's an organic issue masquerading as a psychiatric problem, our treatment needs to focus on the medical side, oxygen, glucose, etc. If it's functional, then we're dealing with a psychiatric condition, and our approach focuses more on supportive care and safety. Initially, it can be hard to tell which is which, so we always keep both in mind. We'll talk more about causes and assessment next. Behavioral emergencies can arise from a wide variety of causes. It's useful to group these causes into categories to guide our thinking during assessment. Let's break down the major categories of causes for abnormal behavior or psychiatric symptoms. Biological or organic causes. These are physical issues with the brain or body. Essentially, something is medically or biologically wrong, and that leads to behavioral changes. Common examples: head injuries or trauma, a concussion or more severe brain injury can cause confusion, irritability, or even aggressive behavior. Neurological diseases, conditions like Parkinson's disease, stroke, or brain tumors can alter a person's behavior or mood. Seizure disorders, post-seizure, post-ictal states often involve confusion or even combativeness as the brain recovers. Infections, a brain infection, encephalitis, or even a urinary tract infection in an elderly patient can cause acute confusion or delirium. Metabolic problems. Low blood sugar, hypoglycemia, is a classic example. It can make a patient seem drunk, belligerent, or unconscious. Similarly, low oxygen, hypoxia, high fever, thyroid problems, or electrolyte imbalances can all affect mental status. Dementia or degenerative diseases. In older patients, conditions like Alzheimer's or other forms of dementia are organic brain syndromes that gradually impair memory, judgment, and behavior. In all these organic cases, the key is that if you treat the physical problem, the mental status should improve. For example, give glucose for low sugar, oxygen for hypoxia, or treat the infection causing a delirium. As an EMT, you aren't diagnosing these definitively, but you should always suspect a possible medical cause and address it. We'll emphasize this again in assessment. Psychological or functional causes. These are what we traditionally think of as mental illnesses. Here, the person's behavior or mood is abnormal, but it's not caused by a visible physical issue like injury or low blood sugar. The brain structure is fine, but its function is disturbed. Examples include schizophrenia, a psychiatric disorder that can cause hallucinations, delusions, and disorganized behavior. Bipolar disorder can lead to extreme mood swings. Mania, which may involve impulsive, hyperactive behavior, and depression. Major depression can cause profound sadness, withdrawal, or even suicidal behavior. Anxiety disorders. Severe anxiety or panic can make someone extremely agitated or fearful without a physical cause. These conditions often have complex causes, genetic tendencies, brain chemistry imbalances, etc., but there's no quick fix in the field because there's no simple reversible medical issue. We manage the symptoms and provide support. Social or environmental causes. A person's environment and life experiences play a huge role in behavior. Stressful events or ongoing stressors can push a person into crisis even if they have no underlying mental illness. Examples include acute tragedies like the sudden loss of a loved one, receiving bad news, or being a victim of a crime. The intense grief, fear, or anger from these events can overwhelm someone. Chronic stress, such as long-term relationship problems, financial troubles, or living in a high-stress environment. Over time, these can erode a person's coping abilities. Traumatic experiences, such as abuse, combat for veterans, or surviving a disaster. These can lead to conditions like PTSD or simply acute anxiety when something triggers the memory. In EMS, you might see a person who is having a breakdown due to life events. For example, an individual who lost their job and home might be found in a hysterical state on the street, no underlying medical or psychiatric illness, but severe situational distress. Substance-related causes. Alcohol and drugs deserve special mention because they are extremely common triggers of behavioral emergencies. Intoxication with alcohol can make people aggressive or deeply depressed. Stimulant drugs like meth or cocaine might cause paranoia, agitation, or even hallucinations. Withdrawal from substances like alcohol withdrawal or opioid withdrawal can also cause severe anxiety, shakes, delirium, or even life-threatening symptoms. Importantly, the medical community now recognizes that substance use disorders are medical conditions, not simply a moral failing or acting out. So a patient behaving bizarrely due to methamphetamine use is still a patient with a medical emergency, toxicity of a drug, and possibly a psychiatric emergency as well. It's very common that more than one of these factors is at play. Real life isn't always neat. Someone with a pre existing mental illness, functional cause, might abuse drugs, substance cause to cope, and then experience a traumatic event, environmental cause, all leading to a perfect storm. Or consider an elderly patient with dementia, organic cause, who gets a urinary infection, another organic factor, and then is moved to a new nursing home, environmental stress. They might become acutely confused and combative. As an EMS professional, keep an open mind. Look for medical causes first, because those you might fix quickly. But also gather info about any psychiatric history or stressful events or substances. This comprehensive view will help you manage the situation and hand off good information to the next level of care. In the next locutor in this series, we will continue our discussion starting with safety and other scene considerations. See you then?